Have you ever felt exhausted no matter how much you sleep, struggled with unexplained weight changes, or dealt with brain fog that just won't go away? What if I told you the cause might not be in your head, but in a tiny butterfly-shaped gland in your neck? Today we're diving into Hashimoto's thyroiditis, an autoimmune condition where your body's own defenses slowly attack the thyroid. We'll explore the biochemistry, physiology, triggers, and treatments that doctors don't always explain, and uncover how this silent disease impacts millions worldwide. Stay tuned, because by the end of this video, you'll understand exactly what Hashimoto's is, how it develops, and what you can do about it. Imagine your body's defense system, the immune army designed to protect you, suddenly misidentifies your thyroid gland as the enemy. Instead of guarding it, the immune system attacks, slowly dismantling one of the most important regulators of your metabolism. This is the story of Hashimoto's thyroiditis, an autoimmune condition that millions have, yet many don't realize until years of fatigue, weight changes, and brain fog begin to unravel their lives. Welcome back to the channel. I am Dr. Victoria Munoz. Before we dive too deep into this topic, please take the time to like and subscribe to the channel. This helps to bring this valuable health information to thousands of people. The thyroid is a butterfly-shaped gland at the base of your neck. Tiny, yes, but it produces hormones that set the metabolic pace for nearly every cell in your body. Thyroxine, T4, and triiodothyronine, T3, are the two main hormones. These hormones regulate oxygen consumption, energy metabolism, body temperature, and even neural development. The thyroid works under the control of the hypothalamus-pituitary-thyroid axis. The hypothalamus releases TRH, stimulating the pituitary to release TSH, which in turn signals the thyroid to produce T4 and T3. Think of it as a thermostat. Your thyroid is the heater, TSH is the temperature sensor, and your hypothalamus sets the dial. In Hashimoto's thyroiditis, the immune system launches a misdirected attack on the thyroid. Autoimmunity occurs when immune tolerance breaks down. Normally, immune cells are trained to distinguish self from non-self. In Hashimoto's, this checkpoint fails. The immune system generates autoantibodies, anti-thyroid peroxidase, anti-TPO, anti-thyroglobulin antibodies, TGAB. These antibodies mark thyroid cells for destruction, calling in immune cells like cytotoxic T lymphocytes. Over time, thyroid tissue becomes inflamed, scarred, and less capable of producing hormones. This slow burn leads to hypothyroidism, low thyroid hormone levels. Patients may notice fatigue, cold intolerance, weight gain, hair loss, constipation, depression, or memory problems. Let's get nerdy for a moment. Thyroid hormone production requires 1. Iodine uptake into thyroid follicular cells through the sodium iodide symporter. 2. Thyroglobulin acting as a scaffold for hormone synthesis. 3. Thyroid peroxidase, TPO, an enzyme that oxidizes iodide and helps attach it to tyrosine residues in thyroglobulin. 4. Coupling of these iodotyrosines to form T3 and T4. Now here's the twist. In Hashimoto's, antibodies target TPO and thyroglobulin, disrupting hormone synthesis right at the biochemical level. The very machinery of hormone production is under siege. Science doesn't point to a single trigger, but rather a multifactorial storm. Genetics, family history increases risk. Genes in the HLA region affect immune recognition. Environment, excess iodine intake, infections, and even chemical exposures can act as triggers. Leaky gut hypothesis, increased intestinal permeability may allow foreign antigens to train the immune system inappropriately. Sex hormones, women are 7 to 10 times more likely to develop Hashimoto's, pointing to the role of estrogen and X chromosome immune genes. Stress. Chronic stress disrupts immune tolerance and may accelerate autoimmune activity. In short, genetics load the gun, environment pulls the trigger. In the early stages, the thyroid may compensate, sometimes swinging into hashitoxicosis, where damaged thyroid cells leak hormone, causing temporary hyperthyroidism. Symptoms: anxiety, palpitations, heat intolerance, but over time, destruction outweighs compensation. Thyroid hormone production falls, TSH rises, and hypothyroidism takes hold. The body slows down. Currently, there's no way to turn off the autoimmune attack completely, but treatments aim to replace hormones, reduce symptoms, and support immune balance. 1. Levothyroxine, synthetic T4, standard therapy, replaces what the thyroid can't produce. The body converts T4 into active T3 as needed. 2. Combination therapy, T4 plus T3. Some patients feel better with a mix, especially those with impaired T4 to T3 conversion. 3. Nutritional support, selenium, supports thyroid hormone metabolism and reduces anti-TPO levels. Vitamin D, modulates immune activity. Zinc and iron, essential cofactors for hormone synthesis. 4. Lifestyle factors, stress management, sleep optimization, and exercise help regulate immune balance. Anti-inflammatory diets, gluten-free or autoimmune protocols may benefit some patients. 5. Low-dose naltrexone, LDN. This compounded medication helps to drop the antibodies and manage the disease. Some patients can reach normal low antibody levels on this medication, but it is very individual. Lifestyle factors play a major role. 6. Future therapies. Research is exploring immune-modulating drugs that may specifically reduce thyroid autoimmunity without suppressing the entire immune system. Hashimoto's often creeps in silently. A person may live years with vague symptoms before diagnosis. Understanding the condition means empowering patients to seek testing, treatment, and lifestyle changes early before thyroid tissue is irreversibly damaged. Hashimoto's thyroiditis is not just a thyroid disease. It's an immune system story, a tale of mistaken identity at the cellular level. But with modern medicine, nutritional insights, and lifestyle interventions, people can reclaim energy, focus, and vitality. So, if you've been dealing with unexplained fatigue, brain fog, or stubborn weight changes, it's worth asking your doctor to check your thyroid, and specifically your antibodies, because sometimes the biggest battles in health aren't waged against outside invaders, but within ourselves. Don't forget to like this video and subscribe to the channel. Leave me a comment below as to how your thyroid has affected your health. I'm Dr. Victoria Munoz. Until next time, take care.